A very good evening all. I'm Aditi Lamba coming to you from our studio located in New York City. This is Vision of Asia. Welcome to our daily South Asian news segment, bringing to you the voice of our community with our keen focus on presenting medical professionals, officials, nonprofits, and many other entities on prevalent issues and events. Here is what is happening all across. More than 8.3 million cases of the novel coronavirus have been confirmed worldwide, with at least 449,000 deaths. Countries such as China and Germany have renewed lockdown measures in some areas following new clusters of cases. Here in the United States, new projections have the state of Florida as a new emerging epicenter. Remember, this epicenter throughout the pandemic has been New York City, but the city, and with its decline in hospitalizations, is now moving towards a phase 2 of reopening. Top officials are again reminding all to be consistent with social distancing, still wear masks and carry hand sanitizers in an effort to reduce transmissions. It is about protecting yourself and others from the infection around you. Also, anti-racist demonstrations continue to spread across the globe following the death of George Floyd, and now Rayshard Brooks, with demands and calls for racial justice as well as equality. Democrats and Republicans in the Congress are currently working on police reform plans. We'd like to take this moment now and reach out to activists, advocates, and public speakers to discuss the need for stronger racial justice and end to systemic racism. Reach us with your opinions on events at itvgold.com. Also write to us if you have experience on the front line or are an essential worker. We look forward to bringing forth more updates and perspectives. Tonight's episode consists of more updates on COVID-19 and its impact with reopening, along with candidates running in on the ongoing primaries in New York. We'd like to urge all our viewers to exercise the very important right to vote if you are a registered voter. Several states are having their primaries on June 23rd. Be sure to cast your vote in your state. Let's now begin tonight's episode and let's take a look at the headlines. Dr. Anuj Vohra addresses South Asian American community, COVID-19 updates and measures, Connecticut. Chivona Newsome, Democratic candidate running for New York 15th Congressional District, primary June 23, 2020. World Vegan Vision distributes vegan meals to frontline heroes in hospitals, ISKCON Temple, Plainfield, New Jersey. This and much more right after a short break. Stay with us in Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lamba and this is Vision of Asia. Beginning the show, we are discussing the upcoming Democratic primary election in New York taking place on June 23rd. Again, if you are an eligible voter, please do exercise your right to vote and make your voice counted this year. Earlier today, we spoke with candidate running for Congress for New York's 15th Congressional District, the Bronx. We spoke with Chivona Newsome. She is the co-founder of Black Lives Matter Greater New York. Chivona is a Bronx native who is dedicated to civil rights, racial justice, and equality for all, and is committed to the betterment of the entire district. Chivona has worked on a $50 billion challenge which created savings and various plans for Black and brown residents of New York. She hopes to advocate for economic empowerment, affordable housing and healthcare, preserving immigrant rights, and most importantly, the dignity and respect of all residents of Bronx. Here is our discussion with candidate for Congress, New York 15th District, Chivona Newsome, and her address to the South Asian American community.
Now, why I'm running on a federal level? Because that's a great question. A lot of people say, oh, if you really want to help the Bronx, why didn't you run for city council? Why didn't you run for a state level position? Because I feel as if I can change the Bronx, I can change the whole nation. I can eradicate poverty with the policies I'm proposing. What happens here in the laws that I'll now have the ability to change will be everything that I'm fighting for. As before, I would have to go to politicians and ask them, hey, can you pass this law? Can you pass this law? And a lot of them were afraid to do so. They didn't want to disturb the status quo. Now the laws that I'll have the ability to write, they'll affect everyone in this country, from urban cities to rural America, for Black and brown. Today, we just heard amazing news about DACA continuing. But what we really need is a true and clear and easier path to citizenship. It shouldn't be so expensive, immigration. It shouldn't be so hard to become an American. So that's something I also have the ability to do. I have the ability to fund proper housing, police reform, criminal justice, women's reproductive rights. These things can all happen with the stroke of a pen, but the people who came before me, they just didn't have the ability to do it, nor did they want to do it.
You know, Chivona, just discussing Bronx as an area, what do you think are the major areas that need concern and that need focus in terms of some of the issues that you're working on? I have an article here which says that Chivona Newsome hopes to be an advocate for universal basic income, Medicare for all, ensuring social security, preserving the rights of immigrants, members of the LGBTQ communities. There are a lot of causes you're working with. What is the most biggest concern for Bronx that you have to focus on with these issues?
It would absolutely be poverty, eradicating poverty, because we see when around the nation and around the world, we see when people are poor, they don't have good health care. They don't have good jobs. They are usually subjected to police brutality. They don't have adequate housing. So my biggest thing is eradicating poverty. It's absolutely economic development. And I've spent time talking to small business owners who look like you and me, and they have a hard time accessing funding that they need to grow their business. And small businesses are the backbone of America. It's a huge part of the American dream. But working and advocating and trying to eradicate poverty, Martin Luther King was working on a guaranteed income. It's the same thing as a universal basic income. Back then, he was asking for $30 million. Now, of course, with the cost of living, it's far greater. By giving every single person over the age of 18 $1,000 a month, and then $500 for each child, that changes things quite drastically. It helps our community. Our community is living, just so you can get a big picture of why I keep talking about extreme poverty, right?
Right.
America's average wages happening here are, the average living wage in America is about $53,000 a year. In the Bronx, it's it's $28,000. We need to change that. We need politicians who care about people. My whole approach is humanity-led. Just because you're poor does not mean you don't deserve adequate health care.
Yes. How has this experience been for you, from campaigning to actually working on legislature that can make a difference? And, personally, how important is this race for you?
This race means everything for me. It means changing America. And I know a lot of people who vote and a lot of people who live here think that it's impossible. But if you can see from the things that happen in the Black Act, if we have radical and revolutionary leadership, all these things can happen. Running for office, I was told that it would be one of the hardest things that I've ever done. And to those people, I want to tell them you were absolutely right. I have not taken a break in 14 months. I don't sleep very much between the social justice and the campaign life happening, but my community is worth it. Humanity is worth it. So if I have to sacrifice myself for the betterment of this world, then I'm here for it. And I'm grateful to take the challenge. And I'm going to be grateful on June 23rd when I am elected into the 117th Congressional of Congress.
What did you have to say about your opponents that are, there are several candidates that are running for this race against you? What do you have to say about them, and how different is your issue and your movement?
Well, I was actually the first Black woman to run for this seat. And I've faced microaggressions. I've faced flat out racism. I was called the N-word by someone viewing the debates. Now that they're done on Zoom, I've gone to women empowerment events at our local Democratic club, and I've been told by leaders that I should run for a lesser seat or I should stay in the kitchen. But what they don't know about me and the lineage of people and ancestors who I come from is it's only made me stronger. And to a lot of the people who I'm running against, which if your viewers went and looked back at the old debates, they praise me for the work that I have been doing on the ground. It's because they're politicians. I am nothing like them. I believe in revolution. I believe in radical change. I believe in swift justice. I believe in justice for all. I think that they respect me, but they know that our views are so different. They want to take office and they want things to remain the same because it has benefited them, even at the detriment of people. We have Ruben Diaz Sr., who is a fan of Donald Trump in this day and age, who's running. This seat is what your viewers need to understand is this is the most Democratic seat in the country, meaning Obama, Hillary, everyone who won the Democratic primary has won by over 95%. So we have someone like that running here, which is unbelievable. Also, we have several people who ran for public advocate who lost that seat. So they're just looking for an easy job. We have about 2 candidates who don't even live in this district, but they feel that it's easy. They feel they won't have to do anything to please the people of the Bronx. And as a lifelong Bronx resident and a native of here, I just can't stand for it. So I think the best choice for our community and for this nation is for the world to get behind a candidate like me.
The Indian American community and its numerous organizations and nonprofits have been working tirelessly in providing COVID-19 relief and resources since the start of the pandemic. These efforts are fighting issues of food insecurity, economic crisis, and healthcare issues due to the impact of coronavirus pandemic and are providing resources and support. Some are also focused and driven towards providing care for the frontline medical workers who are truly sacrificing their time and energy to help stop the spread of the disease. On that, recently in New Jersey, World Vegan Vision, along with other Indian American organizations, came together at the ISKCON temple in Plainfield to prepare vegan and healthy meals for hospitals in New Jersey. Many spoke to ITV Gold on this ongoing COVID relief effort by World Vegan Vision, which has been serving many hospitals across the state of New Jersey since the pandemic hit the state. Great efforts towards care for frontline heroes. If you or your association is contributing back to the community during this pandemic, again, do connect with us on events at ITV Gold. Here are now some highlights from World Vegan Vision's food preparation and delivery of free meals to the JFK Medical Center.
Today we are at ISKCON Temple in Plainfield, New Jersey. And under the directions of Madhupati Das, we are preparing early morning the prasadam for our healthcare heroes who are fighting for us for last several months in the front line. So with the help of World Vegan Vision and Side Saving Academy of India and many other community organizations, we are doing this act of volunteerism philanthropy for several months, and it has been a very effective intervention in fighting against the COVID. And this morning, the sadhuji here, the devotees here, they come in the early morning and prepare the fresh food.
The last 3 months, we have been, with God bless, we have been able to provide at least 2,500 meals until now to all the hospitals and the police stations because of their great service to the community. We just want to be a little bit part of that contributions to them for their whole effort, and so that at least that they can serve the community much better. So God bless, I think we are all being successful until now. We have only 3 more weeks to go, and everybody from the community are so helpful. Volunteers are helpful. ISKCON Temple is so much helpful. Balaji Temple volunteers, as well as also Royal Rice. They have been so helpful to giving all the rices. Volunteers are buying the things. They have all the cooks here. Also, we have a Krishna Garden in Edison. They all have been so helpful to basically providing all the informations and help and connecting with the people and community.
My name is Kaushik Vyas. I am from United Rudra Foundation, and we all friends here together to deliver the healthy food to JFK Hospital, to the front runners winners. So we are here. I have with me Dr. Sunil Parikh, Nitin Bhai Vyas, and all team. We came here together. And this is one of the community we are doing quite a long time. I am basically from Royal Rice Company, and we supply rice to the various community kitchens so they can use it. So this is the best time to help the community.
It's time for a short break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. This is Vision of Asia, Voice of the Community, and I am Aditi Lamba. Looking now at the coronavirus pandemic, its updates, measures, we have another segment of our interview featuring expert in emergency medicine, Dr. Anuj Vohra. Today, the total number of COVID-19 cases in the United States surpassed 2.2 million with at least 120,000 deaths. While this is happening, the country continues to reopen with several implications of rise of cases in some states such as Florida and Texas, while states like New York and New Jersey continue to see a downward trend in cases. New York is actually looking towards a phase 2 of reopening on June 22nd, with retail establishments and other business ready to be open. But what does this reopening bring forth in terms of concerns of the medical community, and how important is then a vaccine to prevent COVID-19 in the future? Dr. Anuj Vohra provided much insight into understanding the coronavirus now, months into the pandemic and its development. He also gave his take on the experience of the entire medical community during this tough time period, and again urged all to continue practicing social distancing and work on building immunity and wellness. Here is Dr. Anuj Vohra.
I think first level is lung disease, okay? If you have chronic obstructive pulmonary disease, or if you have a chronic lung problem, I would say you are probably the highest risk population. And although things may be opening slowly in your area, but I would still maintain my quarantine, okay? Those are the people that really shouldn't be going out. Other high-risk patients are diabetics because they have so many areas of their body that are affected by diabetes. So I would also tell them that they are pretty high risk and should consider staying home until they see the reopening entirely in their area and also how it's affected others in that area. For example, as New York City reopens, if I have a history of chronic obstructive pulmonary disease and CAD, meaning heart disease and diabetes, I'm going to stay home and watch what the numbers show, because if I see a major resurgence in my area, I've got to stay home. I can't be a part of that resurgence because I'm already immunocompromised in comparison to healthy people. And keep in mind that COVID has also affected the healthy. So I would still exercise extreme caution if you have comorbidities.
What about actually seeing a doctor during this time process? A lot of these patients have routine, visits to the doctors to maintain, a lot of medications to maintain. What are your comments on that and the maintenance of that?
First, you should be seeing your doctor. It is safe to see your physicians. You can either do a telehealth visit, telemedicine visit, or many doctors' offices have reopened in certain areas, and they have specific schedules set to keep patients apart from one another, and they're taking increased precautions to ensure it's a clean environment. And another follow-up question I'll just prompt is, if you're not feeling well, you need to go to your local emergency department sooner than later. Don't wait, because what I'm seeing is people are getting worse and worse at home, and then they come in too late to be saved. So if you don't feel well, you're having shortness of breath, you're having chest pain, you're having abdominal pain, you're having any major concerns, go to your local emergency department. My emergency departments that I've overseen have reduced their volume by over a third. So they're open, they have plenty of beds available, you should be able to get in quickly and screened and cleared. You can be discharged quickly, but the goal is obviously to prevent death and promote wellness and health. So don't hesitate to come in and see your local emergency departments.
Another important question that I like to ask physicians at this point in the interview is on racial disparity. This is something that we have spoken about in the healthcare system a lot since COVID-19 has impacted the nation. Have you noticed that racial disparity in terms of the patients that are coming into your emergency departments? And if so, what are your comments on the healthcare system and the disparity seen through it?
One of the nice things about being an emergency department physician, an ER physician, is you treat patients of any insurance, any color, anything, and we're completely blinded to what the patient has in terms of their background, their insurance, their income, whatever it might be. It doesn't matter if you're a billionaire or if you're homeless. We treat everyone the same exact way. So we're emergency medicine is an area with no colors and no boundaries. We're happy and a proponent of seeing everyone and everyone equally.
What is needed in the healthcare system right now, according to you, with everything that's happening with COVID-19?
I think what's needed right now is people to recognize if they're not feeling well, they need to seek medical attention and not be fearful of catching COVID because of seeking medical attention. Because we're seeing more people die at home than we've ever seen before. And that's just, many of these deaths are preventable had they come in for care earlier. So I'd like to see people getting the message of, if you don't feel well, see your physician, whether it's your private physician, or visit your local emergency department for care, because we're ready and open and want to take care of you and make sure that you're okay.
Well, that's an interesting point. We actually do know that people are not visiting the ER enough, the ones that really need to do that. I really hope that message gets across here through this interview. Dr. Vohra, this has been quite a journey for the entire medical community across the nation. And I'm sure with your experience in 2 emergency departments, this must not have been easy. I would just like for you to reflect upon how this has been personally for you, and the impact of being on the front line right now, having a family, and also treating these patients. How are you balancing everything?
So it's a great question. Before COVID, I've been the director of emergency departments varying in size from 10,000 visits a year to over 80,000 visits a year.
Wow.
And my biggest concern in terms of well-being was trying not to take my work home with me. And that's from a stress level. That's from a well-being level. Now with COVID hitting, my fear was, oh my God, not only can I contract this illness that could hurt me, that could kill me, my biggest fear is taking it home to my 4 young children and my wife. Mm-hmm. So it is a game changer in realizing that we're all mortal and we're all at risk, and that I personally could be a vector for illness for my own family.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on our Facebook handle @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight. This is Vision of Asia and I am Aditi Lamba. Take care and be well.